So today we have a 54-year-old guy who had a fall and injured his right shoulder. Now he was having difficulty in abduction, so we took an MRI.
The MRI is showing a full thickness supraspinatus tear.
So we are proceeding for arthroscopic. So now what we see is the subacromial view of the torn supraspinatus tendon. What we see on top is the acromial bone, and the needle is marked where you can see a full thickness tear. We'll be going for a 5 mm medial row ankle. Now since we have tied the knots, medial anchors are deployed. Now we'll be going for the lateral anchor. This is the lateral anchor. We'll be going for that.